Hi, Tanya Keppen, registered dietitian with Tri-Valley Health System. Wanted to talk a little bit about our diabetes support group. We had planned to meet on April 6th, but we will not be having that meeting. So I wanted to just bring some information to you that we were going to talk to you about at that meeting. Joan Megorian, our registered nurse that does diabetes education, was going to be presenting at that meeting, and she has brought together some great information to share. So I'm going to do the best that I can just to kind of summarize that information on diabetes and foot care. So to start that off, I just want to talk a little bit about why it's important to take care of your feet and to be aware of some things with your feet when you have diabetes. Of course, it's always important to take care of your feet whether you have diabetes or not, but just to talk about kind of the anatomy and what goes on when you have diabetes and why you need to take good care of your feet. I'm going to start with that first. So when you have diabetes, you end up having too much sugar in your blood vessels, and that sugar needs to go into your cells so that you can use it for energy. And there's an impairment in that process. And if those sugars are too high in your bloodstream over a period of time, it causes damage to that lining of those blood vessels. So in what's too high, the American Diabetes Association has set the guidelines, their guidelines, and you may have your own individual guidelines for blood sugars or guidelines that your doctor has given to you, and that's great. I'm just going to go over what the American Diabetes Association has recommended. And that is blood sugars too high would be a hemoglobin A1C above 7. 2 hours after the start of your meal, a blood sugar being greater than 180. And also a fasting blood sugar or before meals being higher than 130. So if blood sugars are over those ranges for a period of time, it causes damage to those linings of those blood vessels. I don't know if you're going to be able to see this or not, but that smooth lining, you want your blood flow, you want that to be nice and slick through there. And you can imagine when your blood sugars are too high, it gets like honey or corn syrup flowing through those blood vessels. And that makes that lining sticky and damages that lining through your blood vessels, which can cause plaque buildup to be more prevalent to form, can also cause narrowing of those blood vessels. And so where that comes to your feet, the two conditions that can happen when you have diabetes is neuropathy, which is the loss of the sensation in your feet. And that's damage to those nerves from not having good blood flow, good circulation. And the other problem would be peripheral vascular disease, which is the narrowing of those arteries that are supplying the blood flow to your feet, which can lead to poor circulation. So those two problems, that's how diabetes and high blood sugars can affect your feet. So it's really important. I just want to go over some of the common foot problems with diabetes. I'm just going to kind of read through these here. Athlete's foot is one of them, like a fungal infection. Toenail fungus infection is another one. Calluses, hammer toes, foot ulcers. And those foot ulcers are a result from insufficient supply of blood to the feet, which makes it harder for wounds or cuts to heal. So you might just have a little cut on the bottom of your foot that can turn into a real problem because that blood flow isn't as good as we'd like it to be. A foot corn would be another problem. So when should I talk to my doctor? Some ideas when you should talk to your doctor would be if you have changes in skin color in your feet, changes in skin temperature, red spots, hot spots, swelling in the foot or ankle, pain in your legs, open sores on the feet that are slow to heal or open draining, ingrown toenails, infected with fungus. If you have corn or calluses, dry cracks in the skin, especially around the heel, and an unusual and persistent foot odor would be another reason. So there's some good foot care tips that I'm going to talk about to help with your foot care. is going to be the next piece, just to help with that. So diabetic foot care. It's important to wash your feet daily with warm water. Make sure you wash between your toes, not too hot of water because you don't want to dry out your skin. And dry your feet really well, especially between the toes. That's to help prevent that fungal infection there. Wear comfortable, well-fitting shoes. You want to have a closed toe, closed heel shoe. You don't want your toes to be open, your heels to be open. That increases the risk of dry skin. You guys have known that if you're wearing flip-flops in the summertime, your heels get really dry and cracked. So it's important to wear socks and comfortable, well-fitting shoes. And apply, after drying your feet, apply a moisturizer cream or lotion to the top and the bottom of your feet to help keep those feet moisturized and not dry and cracked. But don't put the lotion between your toes. Check your feet daily for skin breaks, blisters, swelling, or redness. Look between your toes as well. If you cannot see the bottoms of your feet, ask someone to look at the bottoms of your feet for you, or put a mirror on the floor and hover your foot over it so you can see the bottom. Wear cotton socks, and preferably white, and change them every day. The reason for the white socks is so you can see if you do have any bleeding or oozing of pus, anything like that. Trim your toenails carefully and do not cut your cuticles. And strive to keep your blood sugars under control within those target ranges that we talked about, with a combination of medicine, diet, and activity. So it's important to do the carb counting, to know what your carbohydrates should be throughout the day. So that's a good time if you're not sure. That's a good time to talk to your dietitian to see what you should be eating and how many carbs that you should be having at a meal. And activity, it's recommended that you do 30 minutes of physical activity 5 to 7 days a week. And if you smoke and have diabetes, it is very important that you stop. Smoking reduces blood flow to your feet. And schedule your foot exams with your doctor at least every year. And when you go to see your doctor, even if it's not like a scheduled foot exam, have your socks and your shoes off so that they don't have to wait for you to take those off. That way they can easily just look at your feet while you're in that visit, so they can take a look at it. And it's a good idea to have them off at every diabetes appointment that you go to. That way they can look at that. It's also a good idea to put your feet up when sitting. Wiggle your toes, move your ankles to improve your blood flow to help keep that circulation going. And avoid activities that increase your risk of foot injury. Don't walk barefoot. Don't use heating pads or hot water bottles on your feet. Do not put your feet in a hot tub without checking the temperature first. And follow up with your healthcare provider is important. And that's it. That's everything on diabetes foot care that we have. If you have any questions, feel free to give me a call here at Tri-Valley. As for our cooking demo that's going to be in May, be looking for something to come out on that soon. We're not sure yet what we are going to be doing with that. So thanks for your time today.